Switch over to the next slide. So at the heart of the work that we do at Human Services is a mission to serve people in New Jersey in a way that helps them thrive. To me, that means building connection and community while also building out our care continuum. Health is not simply a matter of access to healthcare. Health is all-encompassing and impacts the human body physically, mentally, externally, and internally. I'm going to share a quote from researcher and author Brene Brown. Hold on, I may have switched the screen on you guys. Okay, here we go. So I'm going to share a quote from researcher and author Brene Brown, who defines connection as the energy that exists between people when they feel seen, heard, and valued, when they can give and receive without judgment, and when they derive sustenance and strength from the relationship. This is from her Atlas of the Heart book. Connection is an essential part of building a happy, healthy life. And the former Surgeon General warned us that loneliness can be harmful to our health, just as smoking is. And individuals with disabilities are among the populations with the highest risk for isolation and disconnection. And according to Surgeon General Dr. Vivek Murthy's groundbreaking advisory, Our Epidemic of Loneliness and Isolation, we know that this is so important to recognize now more than ever. It's no surprise, because of this concern about the impact that loneliness has on our overall health, it's no surprise that people with disabilities face higher risks of also experiencing health disparities than people without disabilities. So this is the core of why building inclusive communities helps us all. When our environment and our social structures support connection, we are all healthier for it, physically and mentally. So today's event is the culmination of Inclusive Healthy Communities grant-funded efforts by Nutley Family Service Bureau, which were awarded the Human Services Division of Disability Service, which were awarded by our Division of Disability Services within the department. So our department's Division of Disability Services established the Inclusive Healthy Communities Grant Program in 2021 to support community organizations, municipalities, counties, local governments throughout New Jersey to partner with individuals with disabilities to enhance accessibility, health, and equity. And the program aligns with the nothing about us without us ethos of the disability community, as lived experience of individuals with disabilities is required to be incorporated into the planning, execution, and the policy development and the recommendations from the grant-funded work of this program. And Nutley Family Service Bureau and their partners embrace the charge to address inequities in their community that impact everyone through health, through policy system, and environmental change. And I'd like to recognize them for their hard work and thank you for putting today's impressive symposium together. And I hope that this work continues. And I'm excited to see all those who have joined today and knowing all those who will be watching the recordings afterwards. So it's estimated that 1 in 5 people nationwide and approximately 1.75 million New Jersey residents have a disability that might potentially limit their physical or cognitive functioning. And so we view the IHC grants as a way to encourage organizations and local governments to help us build the supportive communities that we all need to be connected. So I will today give you some examples of IHC grants that are working to improve the ability for individuals and disabilities to get physical, social, and mental health support, and really changing the way our communities are built and designed and how programs throughout the state are operated that make them more inclusive so people with disabilities have access. So for example, the Rowan Virtua Regional Integrated Special Needs Center, known as RISN, is using their grant funding to improve sexual and reproductive health care for women with intellectual and or developmental disabilities, or I'll refer to that population as IDD throughout this presentation. So just a note for that. So according to data from Risen, only 15% of women with IDD receive routine Pap screens, only 15%. So through our grant funding, individuals with IDD can join their peers and clinicians to learn about what happens during a gynecological examination in a developmentally appropriate way. The program that they operate also provides training to medical professionals at all stages of their career to better understand their patients and their unique needs. By reducing stigma, addressing patient fears, incorporating peer connection, and empowering patients in their healthcare decisions, the Risen Center is elevating the standard of care for this population, making reproductive healthcare more accessible and working to eliminate healthcare disparities. We also funded another healthcare provider called Woods Services through our IHC grants. And so they've been focusing on improving access to into both integrated primary and behavioral healthcare for individuals with IDD. Woods Services is a pretty large provider based primarily in Pennsylvania, but more recently in New Jersey, and some of your organizations may partner with them. So Woods Services provides healthcare, dental care, residential care, behavioral support, and advocacy for about 22,000 individuals with IDD. And so they were awarded grant funding that supported the development of, or supported an inclusive primary care clinic in Salem County, New Jersey. And through that clinic, they also provide training of primary and behavioral healthcare providers to serve individuals with IDD. And they also developed, using the assistance of, they developed an advisory board comprised of individuals with disabilities and other stakeholders, people with lived experience. They're also implementing a health equity framework for disability-friendly healthcare, and which is definitely a project to stay close to as they build out this initiative and serve as a resource to other providers. This is so needed. We hear constantly at the department from the individuals that we serve and their families, individuals with disabilities, about how challenging it is for them to help find access to behavioral health and medical professionals. I'm really appreciative of any of our initiatives that really focus on building out capacity across the provider community. So while I know today's event is geared towards the provider community, the work of improving health through connection and inclusivity happens really outside the walls of hospitals and clinics too. We know the health benefits of spending time in the great outdoors. And I'll share a little bit about myself. I started my career before government. I started my career in healthcare as a recreational therapist and a child life specialist. I worked primarily in inpatient rehabilitation. I had some time in medical daycare centers working with children with complex medical needs. And really my focus as a recreational therapist was helping my patients with serious injuries or those who acquired new disabilities engage in recreation and leisure. This was a critical focus in our patients' treatment plans because not only did recreation and play have therapeutic benefits in the rehabilitation phase of recovery, clients also needed help developing a plan for how they'd engage in leisure and social activities in their homes and in their communities, especially if they were leaving a hospital or a rehab center with a newly acquired disability that would really have an impact on how they really just have an impact on their daily life moving forward in a way that they needed guidance and encouragement. So often my patients and families and their families faced barriers to return to their activities or start new ones due to lack of accessibility, due to discrimination, due to fear of failure, and a general sense of not feeling welcome, even in the spaces that they had really occupied prior to their injury or their hospitalization. And over time in my career, I branched out from working in facility-based care and focused with my employer on developing both inclusive and specialized community recreation and adapted sports programming, primarily for children and young adults, but also some for adults with disabilities. And the individuals I worked with and their families saw a sense of community that we created together in these programs. I will say it was a community one where they and their loved ones felt accepted, they felt welcomed, supported, and could just focus on having a nice time and enjoying the connections that they're making. One of my favorite programs to run before I came into government was a teen program where parents were not allowed to attend or participate in any way. So we really provided opportunities for the teens and young adults with disabilities to hang out, to try new experiences, and to just be treated like any ordinary teen, which sounds so simple, but it took a lot of intentional design and feedback working with the teens and lots of coaching of the parents to help ensure that we really hit the mark. And this program was really just about letting teens be teens. And we went above and beyond, sometimes to create some pretty special experiences, from game nights to bonfires to zip lining to camping, like weekend camping trips, to riding boats on the bay, playing laser tag, going to college football games, medieval times, etc. And part of our program coordinator's role in running that program was also to plan events that were as inclusive as possible in the community. They weren't like large events, but really just focused on a night out with the teens. Sometimes it was a big group, so that was a little hard to manage. But one of the important parts of that program was also providing education to any community venue, to the businesses we worked with or organizations that we worked with in our planning to help improve improve the experience of any disabled person that might want to have the same experience as our participants in the future. So we would do a lot of planning and discussion and assessment ahead of our events, coordinating with the venue and just making sure that we could provide the most inclusive and positive experience for our participants, but also helping to provide feedback and guidance to the individuals to help make sure that that feedback might improve experiences for people beyond us. And also just give our teens a chance to go back with their families or friends, or over time. A lot of the venues and businesses we worked with became more welcoming for people in the public. So I'm an outdoor lover, so I am biased, but it was incredibly meaningful to me anytime I was able to share or help provide an outdoor experience for my patients to leave the hospital for just a small period of time, or for our community participants to have an outdoor adventure, because the direct impact of fresh air was transformative. And so this reminds me of, I'm going to share my screen to show you a video, but this reminds me of our IHC grantee, the Pinelands Preservation Alliance, or I'll reference them as PPA, who thoroughly embraced the spirit of the IHC program. They allied with individuals with disabilities and with organizations dedicated to the welfare of people with disabilities and the public and private landowning agencies. But experiencing the Pinelands can be difficult, if not impossible, for people with physical or other disabilities. And to overcome a lack of access and accommodations, PPA used their IHC grant to create accessible trails. They purchased adaptive outdoor equipment. They developed a mobile-friendly website to indicate which trails are accessible and open in real time. So they've also since then convened an Access to Nature forum to hear the voices of individuals with disabilities and their caregivers, and support the Alliance's Pinelands Adventures program, which provides guided nature trips for everyone, including people with disabilities. Now, if I sound effusive, it's because our team got to spend an incredible day in the Pinelands with PPA and with the Department of Environmental Protection to experience firsthand the work supported by the grant. So I'm going to show you a short video about that day. Catherine, I might just ask you to confirm that I'm doing this right. Can you see the video now on the screen before I hit play?
Yes.
Okay, great. Thank you so much. And just let me know if you can hear the sound once it begins.
The world is a space for people with disabilities first. People with disabilities are
Might want to turn it up, Kaylee, or maybe that's us. I don't-
We are here today to celebrate one of our inaugural grantees, Finance Preservation Alliance. They have been working to make places such as ASEAN and other places in the planet more accessible for people with disabilities. And we're just really excited to wait for their work.
So we're here today at Side Recreation Area, which is a terrific place to come and visit for anybody. There's a beautiful lake where you can paddle, and there's an excellent trail system. Particularly the red and blue trail here are designed and maintained for accessibility. So they work quite well with wheelchairs or people who use a walker or who are perhaps less steady on their feet. With the Finance Preservation Alliance, I'm the Access to Disability Advocate. The work that we've been able to accomplish with improving trails and making trails, make them more inclusive and accessible, working on kayaking programs and activities, is important work because this is public land, so everybody has investment in this land to be able to provide these types of services is very humbling.
20% of our residents have a disability, so without prioritizing equity and access, we want to make sure that our public places, our parks, our natural resources across the state are available for everyone to enjoy.
But it was really nice for me as a deaf person to be able to walk next to somebody and maintain eye contact and communicate with them. You're out here actually doing what you're supposed to be doing. You're not worried about the trees hitting you. You're not worried about the birds being stung. So you can really focus on enjoying the nature and your friendship or who you're watching. Wow, it's definitely so great.
Bad, the worst,
Okay. Don't need to see the YouTube ads. Let me just switch back over to the presentation. Okay. Thanks so much for giving me a moment to share that video with you. I think it was a great break for you to see and hear from individuals that we partner with directly. Because outdoor activity really can enhance a wide range of health factors. I felt like my mood got boosted just from watching the video of people out in nature. It boosts mood, it boosts confidence, and it improves mobility, improves your cardiovascular health. These benefits apply to both individuals with disabilities and people without disabilities. So the upfront investment in our IHC grants to create more inclusive, accessible public spaces is worth every penny to us. We've issued more than $7.3 million in grants to organizations and local governments around the state since the program's inception in 2021. And what's more, our Division of Disability Services is actually reviewing applications for the 4th cohort of the program right now. And we are looking to award $3.5 million to the next round of grantees soon. So keep your eye out for that application of the award announcement in the coming weeks or months. I'm really proud of the work of the IHC grant program and the work of the grantees alike. I could go on for the rest of the hour about their work, but I do want to make sure to talk about some of our other accomplishments. So I'll mention that when Governor Murphy first came into office, we knew that it had to be a priority of ours to address gaps in the behavioral health care access for individuals with disabilities. We've actually seen a rise in complex behavioral needs among children and adults with IDD. And since we know that population experiences a higher prevalence of behavioral health disorders than people without disabilities, this demand is even greater. So for context, our Division of Developmental Disabilities, or what we refer to as DDD, funds services and supports for nearly 28,000 adults over the age of 21 living with IDD in the community. Our goal is to support adults to live full, healthy, active, and engaged lives in their communities, prioritizing individual choice and dignity to decide where and how they receive services. So toward the start of our administration, we engaged Rutgers Center for State Health Policy to conduct qualitative and quantitative research on our behalf to identify what makes a successful crisis intervention system for this population specifically. They spoke with experts, they reviewed hospital data, including Medicaid claims, they surveyed stakeholders, and they worked to identify gaps in New Jersey's care continuum. And the findings showed that we needed to develop acute residential behavioral health resources and provide even more support in the community to address the specific behavioral challenges before they turned into a crisis. And directly as a result of this research, we designed 2 new programs. So DDD, a couple of years ago, awarded a competitive contract to a provider that we brought in new to the state. So the provider is the Young Adult Institute, or you might know them as YAI. So in 2023, YAI opened the first of 3 pilot behavioral health stabilization group homes funded by DDD. The second home is now open, and the third one is expected to come online this year. So these short-term settings provide a safe and a structured environment to stabilize and support our DDD consumers that have complex behavioral needs. And the program's really geared at preventing unnecessary hospitalizations and providing intense training to consumers' caregivers to help facilitate a successful transition back home. So in this model, individuals are admitted on a short-term basis from their prior home, either a group home, supported, like any kind of licensed residential setting they may have been living in, or their private home. And some individuals actually may have been admitted directly from a hospital stay or a behavioral unit in acute care. So the interdisciplinary treatment team within these homes consists of board-certified psychiatrists, behavior analysts, registered nurses, and transition navigators. And they're focusing on delivering trauma-informed care that has really made this pilot successful so far. And I'll say so far because we're still measuring the initial results from the stabilization homes, but the early data is encouraging. So let me pull up just some preliminary slides that I can show you some of our data. So over the course of the program so far, we've seen a total of 24 admissions, 16 discharges, with an average length of stay of 90 days. And the majority of our admissions were referred to the homes, and this is through DDD. So all of the referrals go through DDD, and they're based primarily on presenting challenges with physical aggression, self-injurious behavior, elopement, severe property destruction, or verbal aggression. And while we don't have enough data yet to know a statistically significant change, we have observed a decrease in emergency department usage for individuals at the state who've gone through the stabilization program. So for 7 individuals who we have been able to follow for 1 year post-discharge, their average number of ER visits from 1 year prior to admission to 1 year post-discharge have dropped from 21, about 21 visits to 9. Another measure we're monitoring is the average number of behavioral incidents recorded pre-admission and post-discharge. So for the same 7 individuals, for instance, the average number of behavioral incidents dropped from 10 prior to admission to 5.7 in the year post-discharge. Again, these are early numbers, and each individual admission is unique, but their circumstances are also unique. But these initial results are so encouraging, and this has become such a valuable resource to our consumers and also to our team at DDD when we're really trying to help discharge individuals from hospitals, and when they're struggling to get to successfully transition back into their homes, they need a bit more of a structured, more higher intensity behavioral program. And this has been an incredible resource, and so grateful to the YAI team for expanding. So I'm really excited to see where this can take us in the years to come. So I mentioned that we had launched 2 new programs, so I'll share a bit more about the second one. So the other program that we've launched is called NJ Start. So this program will bring another evidence-based community behavioral health crisis prevention and intervention service for adults with IDD to our state. START stands for Systemic systemic therapeutic assessment, resources, and treatment. It's a model that we will be adopting in collaboration with the National Center for START Services, which is an initiative of the University of New Hampshire's Institute on Disability. So this model has gained national acclaim for its focus on reducing ER visits, hospital admissions, calls to police, caregiver burnout, and builds community capacity to successfully support people with IDD, with both IDD and mental health needs. So last year, in our budget, last fiscal year, we included a new investment of $3.2 million in DDD's budget to pilot a crisis stabilization team using the START model. This model includes staff training, the materials, and the resources necessary for service provision. And the pilot is starting in the state's southern region. So the contract for this program was awarded last October. It's in its initial phases now. And once the initiative launches, the program staff will be traveling throughout the southern region of the state to private family homes, to licensed residential centers, and they'll be providing short-term crisis assessment, guidance, and linkages to additional services for our DDD consumers. Building out this continuum of care that specializes in serving people with disabilities helps us serve the whole person with dignity, compassion, and clarity, because the complex needs of individuals with IDD and with disabilities sometimes really does call for providers to have to adapt their approach to truly meet people's needs. Research indicates that up to 40% of individuals with IDD referred for inpatient psychiatric stays have undiagnosed or undertreated medical problems. 40%. I think I need to say that again. The research indicates that up to 40% of individuals that are referred for inpatient psychiatric stays have an undiagnosed or undertreated medical problem. This really does underscore the importance of continuing training for healthcare providers to meet the unique needs of people with disabilities. One of our partners who are here today, the Boggs Center for Disability and Human Development, part of Rutgers Robert Wood Johnson Medical School, supports training on providing safe, accessible care for individuals with disabilities. And you'll be hearing more about the Boggs Center from Melissa Cheplick shortly about their incredible work with individuals that have dual diagnosis of mental health and developmental disabilities. And a lot of our work at the department with the Boggs Center focuses on not just community education, but workforce development. They have been integral in building out a community of healthcare and direct support professionals. You might hear me refer to direct support professionals as DSPs today. So they've been really helpful in building out our care economy to offer a variety of services. So let me just move to the next slide to show you something. Okay, so in response to the workforce challenges across the care economy, the Boggs Center has been a truly incredible partner. Together, we partnered with them to create the Jobs That Care campaign to promote rewarding careers, including DSPs, direct support professionals. So Boggs developed a website rich with content, promoting the work of DSPs and providing resources for prospective employers, for prospective workers. And the website can be found at jobsthatcare.nj.gov. We were also really fortunate to have money in our budget over the last couple of years to launch paid advertising campaigns for many of our services across the department. And we included a paid advertising campaign to promote this resource specifically. So Jobs That Care helps connect employers with people interested in serving as direct support professionals or certified home health aides. And I'm going to pause real quick and show you just one example, a clip of one of our campaign resources. These videos were awesome.
Support professionals and certified home health aides are support professionals.
Oh,
The certified home health aides are in high demand. These jobs are critical in helping older adults and people with disabilities thrive in their homes and communities. New Jersey's Department of Human Services can help connect you to jobs and training. Visit jobsandcare.nj.gov.
I apologize for how quick that video was. So it was probably very difficult to interpret into ASL.
How long before you finally start?
That's not part of the presentation. That's a YouTube ad. Let me exit out of that for you. Again, I apologize. That was probably too fast to translate into ASL. So I'm happy to share a transcript after. Okay. So like I mentioned, the rest of the country, New Jersey's care economy is facing a massive strain. It couldn't come at a worse time, because at the end of this decade, there will be more adults over the age of 65 in our state than children under the age of 18. So with these changing demographics and our continued commitment at the state to serving people with disabilities and people with medical needs in the communities where they live, a well-trained, high-quality care workforce is imperative for supporting independent community living. So that's why, since the beginning of the Murphy administration, we've invested more than $1 billion of funding for rate and wage increases for direct service professionals, DSPs, behavioral health providers, certified nursing assistants, child care workers, and home health aides. We also recently announced the final awards for our community-based loan redemption program that granted up to $50,000 of loan redemptions to healthcare professionals, to each healthcare professional, in exchange for them in exchange for 1 year of service at an approved home and community-based services provider agency supporting our state-funded programs. So specifically, we had funding dedicated to support healthcare professionals working in CSOC, contracted agencies, CSOC meaning the Department of Children and Families. We had funding dedicated to healthcare professionals serving the DDD system provider agencies. We had funding dedicated just for Medicaid's private duty nursing agencies, focused on primarily nurses. And we also had funding dedicated to our Division of Mental Health and Addiction Services contracted agencies. The program generated significant interest as we expected, and we received applications from over 1,000 professionals for consideration. So with $17.5 million in funding from the American Rescue Plan Act, we awarded nearly 450 participants to participate in this program. Okay, so moving on to a couple other initiatives focused on healthcare and the ways that we've been working to strengthen our healthcare and care economy, our healthcare workforce and care economy. I'll mention that I'm also really proud of the work that we've done through DDD in conjunction with the Bog Center. So a couple of years ago, the Bog Center helped us convene a committee that was brought together to evaluate our direct support professional training curriculum. They conducted intense stakeholder engagement and analysis where they really reviewed national best practices, identified what those core competencies truly need to be for DSPs to feel equipped and confident in their job. And they did a deep analysis, and we took a series of recommendations from this group, and we nearly doubled the hours of training that all DSPs must complete as they begin their work. So I think we went from 30 hours of initial training to 60 hours, and we were really fortunate in our budget this fiscal year, so FY25, to receive funding to help ensure that our rates supported the significant increase in initial training for our DSPs. So these trainings span from supporting community inclusion to effective behavior supports, trauma-informed care, medication administration, and more. And I have to just say, we would not be able to deliver the breadth and depth of services available now without the help of the Bog Center And I'm just so deeply grateful for their work. So I know all of you understand how important it is to bring qualified and compassionate people into these fields, and it's so important for us to put steps in place to ensure that they feel prepared and confident to do their job well, so that they can also build strong relationships with their clients to support them in the best way possible. This requires trust, it requires commitment, it requires good compensation and recognition. And more broadly, these more broad goals really require providers who are willing to take the time to better understand their patients with disabilities, participate in Medicaid, and be willing to take extra time to communicate with their patients. This is actually quite true for many of the populations we serve. So in circling back to the topic of our aging population, each day, 10,000 more Americans turn 65 years old. I can repeat that again. So every single day, 10,000 Americans are turning 65. So not only is it the preference of the majority of Americans to remain in their homes and communities as they age, connections within the communities and the strength of our relationships can play an enormous role in our long-term health and our vitality. So this is why one of the main components of our New Jersey statewide age-friendly blueprint that we developed and published last year is socialization. So this slide deck will be shared with you all after, so I'm not going to open it up and browse through it, but it's an incredibly rich document. It's posted on our website as well. So we call it the age-friendly blueprint, and it's filled with best practices for communities and all levels of government to implement more inclusive policies that better support an aging population. So when you purposefully build policies and physical spaces that encourage inclusivity and engagement for all community members, including those with disabilities, everyone wins. And so to help our blueprint come to life, last month, Human Services awarded $2.2 million in grants to local governments and to community-based organizations to develop age-friendly, inclusive initiatives and implement recommendations from our blueprint. And from expanding transportation services to funding home modifications and repairs to creating opportunities for people of all ages to connect, these funded initiatives will help build bridges, expand access to critical services, and make these communities better for all residents. I will encourage you, if you are not signed up for our listserv or don't follow our department on social media, I encourage you to do so. And to keep your eye out for potential additional grant funding opportunities coming up in the coming months. We have additional funding dedicated to these grants. If anyone needs help accessing how to connect with us, at the end of my slide deck, I also have our social media links as well. So elsewhere within Human Services, my colleague Liz Hill will be presenting later today on the intersection of mental health and the deaf and hard of hearing community. So as the director of our division of the deaf and hard of hearing, Liz has really been at the forefront of inclusivity statewide, especially with the grants that we've issued through her division to counties to implement hearing loops and other assistive technology to improve access throughout the community for this population. So last spring, we awarded over $310,000 in additional funding to 5 counties to improve communication and language access for residents of all ages. So that included Bergen, Camden, Mercer, Morris, and Union counties. They all received funds to install hearing induction loops in public facilities. They hired communication access, real-time translation, and ASL interpretive services, or they implemented assisted listening devices in highly trafficked public spaces. Just a couple of weeks ago, Liz was out visiting the Mercer County Administrative Building and got to see in real time the results of these installations. It's incredible, and we're really proud of these grants. we actually, that last spring's award built on the nearly $1 million that we issued to 13 counties in April of 2022. These really popular grants are making a difference in connecting our neighbors to services they need and just access to buildings and other engagements that they really depend on for independence, to be understood, and to live safely. So please, as I mentioned before, keep your eyes out for similar opportunities from us in the near future. So additionally, I'll say a few more words about DDHH. The division also serves as a rich resource to healthcare providers. They issue guidance and have published a lot of resources and materials, including the Medicaid Guide to Requesting Communication Access. I'm just sorry, I just want to do a time check. How much time do we have left, Catherine?
We have about 10 minutes.
Okay, I will wrap up, and then if you want to do questions, we can make sure.
Sure.
Okay. So I was mentioning that DDHH has a Medicaid guide to requesting communication access. It's posted on their website along with other materials. So I'll leave it to Liz for sharing more as well. So I forgot to advance the slide for DDHH. So they've got incredibly rich resources. Okay. So I also want to share that last summer, we actually launched a disability information hub. So this is a website that I like to call a one-stop shop. So it's a central location to navigate disability-related resources offered by the state. It's incredibly user-friendly, it's intuitive, it's always evolving and being updated. And we designed this site in collaboration with people with disabilities. So I really encourage you to check it out. It's at nj.gov/disabilities. I will also mention that I'm going to just say that in order for us to continue this work and build a future that supports the mental and physical well-being of everyone, I have two important calls to action for everyone here today. So the first is to get more healthcare providers involved in our home and community-based services. Our divisions do incredible work connecting people with disabilities to the programs and services they need, but we need to make sure that the entire healthcare community is involved. So as I mentioned earlier, not all healthcare providers feel confident working with patients with disabilities, with complex health issues and communication needs. So we always need more providers, especially in the behavioral health space, to embrace serving this population. Second, it would be impossible to continue to build out the continuum of care for individuals with disabilities if the federal government made drastic cuts to Medicaid that are currently on the table. So in the House, representatives have voted for a budget resolution that strikes $880 billion from the programs overseen by the Energy and Commerce Committee, including Medicaid, Medicare, Social Security, and the Supplemental Nutrition Assistance Program, or SNAP. So given previous policy proposals aimed at shrinking Medicaid funding, like reducing our federal match and implementing work requirements, New Jersey is looking at a possible cut of $10 billion. New Jersey Family Care, our Medicaid program serving nearly 2 million New Jerseyans, is a $24 billion program. $14 billion in federal dollars and $10 billion from the state budget. So if the cuts go through, there's no way the state can fill the funding hole by itself. So what does this mean for programs and services funded by New Jersey Family Care? So as the state administering agency for Medicaid, we would have three policy levers that we can pull to make changes and still be in compliance with state and federal law. So we would have to either change who's eligible for family care, which services would be covered, and how much we pay providers to deliver services. So those are the three levers. So this is why we estimate that with these cuts, we estimate up to 700,000 New Jerseyans could lose access to care. So I bring this up just because we need everyone to be aware of the potential outcomes of these federal decisions and to let their representatives know how important Medicaid is to the viability of our healthcare system and to the lives of New Jersey's most vulnerable residents. I'd I'd like to just read a portion of a letter from a New Jersey woman, Kate, who is a co-guardian of her sister-in-law with an intellectual and developmental disability, because Kate recently participated in a roundtable with Commissioner Edelman and Governor Murphy, highlighting the critical importance of Medicaid, and she gave me permission to share some of her letter with you. We'll just read this and then wrap up. So here's some photos that she gave us permission to share. So this is from Kate. She said, my sister-in-law, Jessica, was born with Lennox-Gastaut syndrome and is intellectually and developmentally disabled. My husband, Jason, was just a baby when his parents first suspected she wasn't meeting normal childhood milestones. Her first tonic-clonic grand mal seizure was when Jess was about 4 to 5 years old when the family was in a car. Her medication regime to control her seizures requires 5 drugs to manage the most severe of her seizures. Between seizure meds and medications for her other medical conditions, she takes about 15 to 16 pills twice a day. She has not had an easy life, and the repercussions went far beyond her. My husband recalls growing up with constant uncertainty over unpredictable behavioral outbursts, her limited ability to communicate, and anywhere from 3 to 5 major seizures a day that often resulted in injury. There was a constant rotation of caregivers who would help for a little while before giving up. After my mother-in-law passed away in 2009, Jason became Jessica's sole guardian. He tried for a year to care for her on his own, but wasn't able to manage and ultimately placed her in a group home. That decision weighed heavily on him, and in the 15 years since, there has not been a day when he hasn't called her or a week when he hasn't gone to visit. 2023 was a particularly bad year. Jessica was inexplicably catatonic after a rapid series of major seizures following a broken ankle in August and subsequent infection. Jason and I thought we were going to lose her, but she pulled through. We were at her side for months through an extended hospitalization, followed by a very fraught and ill-fitting 4-month stretch in a nursing home after losing her housing due to her medical status change. This long stretch in an institutional setting had an extremely negative impact on Jessica. She developed severe anxiety and dramatic escalation of behaviors around getting out of bed, getting dressed, bathing. She no longer showed any interest in any of the activities she had once loved, and she was a shell of herself. We were extraordinarily lucky to have enough resources in our state to help get her out of that nursing home and into a medical group home placement. Jessica is happy and healthy these days in her new group home, and once again is engaged in her favorite activities. She loves writing, painting, going out shopping, having a girls' day with nail painting and grooming, helping out on simple tasks, baking, and doing her exercises. Her entire existence is dependent on federal and state assistance, and we are involved in active guardians, but the extent of her needs are far bigger than what we can manage on our own. The fight against impossible odds is worth it because Jessica is worth everything. Kate told us that because of Medicaid, Jessica is able to get the care that she needs, and Kate and Jason to enjoy their relationship with her as family. They get to be in connection with her, not worrying about the cost of her medications or how to navigate round-the-clock care. And that's the goal for us too. To live in a state where we all have the resources and tools we need to be in community and to be in connection. As you hear today's amazing speaker lineup, I encourage you to imagine how you and your community can think a little bit bigger, open your circle a little wider, and to reach a little deeper for connection. Small, thoughtful changes can really make an enormous difference in a person being seen, heard, and valued. I want to thank you all so much for the work that you do every single day. And again, thank you so much for having me here today. Catherine, I'm not sure if we have any time for questions, but I'm also happy to follow up with anyone that has any questions today.
Yes, so thank you so much. This has been such an informative presentation. I personally was taking a lot of notes, and happy that we're going to have a recording, and that was a really powerful story. So there's just there's so much need, and there's so much good work going on, and just want to thank you for your leadership and all you do. I do have some I'll read 2 comments in the chat. One's a comment from Melissa, and Kaylee, honestly, we do have 15 minutes, so to answer your question.
Okay.
We have until 11:15. So Melissa Cheplick said, just thank you so much, Kaylee, for sharing the info and for your leadership. So from our participant, Mike Evangelista, who's a trustee and one of our CAC members, Mike asked, does New Jersey have programs that specifically target assist caregiving youth? And I will, and also if people want to, if Mike, you want to unmute yourself and add to this, you can. Please do.
Well, I know of some other groups that particularly target caregiving youth in other states. And I was just wondering if New Jersey had any programs to help caregiving youth, because there's a lot of people who do need, who care for older adults and siblings and do need a lot of help.
Yeah, thank you. Michael, when you're saying caregiving youth, are you referring to the caregivers for children and youth?
Not
Like
some for caring for youth, but also youths, young people caring for other family members,
Yeah.
particularly the elderly.
Yeah, thank you so much, Michael, for your question. So caregivers across the board, regardless of their age, are a high priority population that we serve here in Human Services, because we are caregivers across our department, both in the work that we do, but also personally, many of us are. And as our Assistant Commissioner, Louise Rush, she oversees our Division of Aging Services. She always likes to say, if you are not a caregiver and you haven't been a caregiver, it's very likely that you will be a caregiver. So we have, a couple of years ago, we launched a caregiver task force that brought together stakeholders and representatives of caregivers from a variety of communities, and actually issued, the task force themselves issued a report. And we've been working on some initiatives that directly resulted from that report's recommendations, including the creation of a caregiver hub that will provide opportunities for caregivers to complete their own assessments to assess their needs, and then link them to different resources offered throughout the state. So one of the first places I always recommend any caregiver of any age to start with is going to their county's, we call it the ADRC, the Aging and Disability Resource Connection. And that's actually also known as your AAA. So many acronyms. It's also known as like your Office on Senior Services within every county. And that's a little bit deceiving, the name Senior Services, because they have a lot of services and supports for many people. So that's a great place to begin. Last year, we actually launched a paid advertising campaign to promote the resources we have for all types of caregivers. It ran bus ads, like on buses and radio ads, etc. And we really tried to not use the term like, are you a caregiver? Because what we learned in our work with the caregiver task force was that there's so many people who are caring for loved ones that just do it because that's just what they do. They wake up and they love their loved ones and they provide care, but they do not identify as a caregiver. So any of our services and traditional ways of connecting with supports really sometimes surpass, like they don't reach a lot of people who would benefit from those programs. I'm going to just share my screen really quick, Catherine, just to show you, Michael, a part of our, oops, I'm sharing the wrong screen, hold on. To show you just a piece of our Disability Information Hub. This is the main page. All right, Catherine, are you seeing the screen or no?
Yes.
Website?
Yes.
Okay. So this is we actually make it pretty easy, so you can scroll down and you can actually click on resources by disability community. And there's ASL videos and an introduction video to the hub. And then we also have resources by life stage. So one of the main links is we have sections that are services dedicated specifically for children with disabilities. We have resources based on for individuals with disabilities that might be transitioning into adulthood, which is a very difficult time for individuals and their families. We have a link for a whole bunch of resources targeted to older adults. And then we have a link just for caregivers that is incredibly rich and gives you a sense of where to start. Because right, as a caregiver, regardless of the age of the loved one you're caring for, navigating our system is very overwhelming. Like, are you eligible for Medicaid? Are you not? And every county has different services that are funded by the county, especially for older adults and people with disabilities. So there might be something that if you're not eligible for Medicaid, we have state-funded respite programs. We have state-funded Alzheimer's programs. So for additional resources for people that might not meet eligibility for Medicaid. And this is like primarily on the adult side. So that I would just encourage you to take a look at that.
Okay.
Disability Information Hub.
Thank you.
Of course. Thank you for the question.
Are there other questions? Would anyone, you can unmute yourself or you can put it in the chat. Don't.
Happy to be a resource. You have my slide deck, Catherine, to share with the group. It will link to all of our social media pages. I'm happy to do any follow-up with folks. But I appreciate the opportunity to connect with you all and to share just a little bit of the tremendous amount of work that the staff in our department do every single day.
Well, thank you again so much. This is, we know, I'm aware that program, like of these programs, but to hear you speak of them just brings so much more clarity and, just reminders that how to get to them, and to see and to hear personal stories too is just just very brings up a lot of emotions, and just reminds me of all the work that's so important that we do every day for people. So I just so grateful that you could join us. And I mean, if there are no more questions, I don't want to keep you. But I think we don't have any more questions. So I want to just thank you again for presenting today.
Thanks, Catherine. Everyone have a great rest of your day. Enjoy the presentations.
Thank you, Kaylee.